Hello, my name is Jonathan Coach, and I'm doing the case study 6G on Treponema pallidum. So for the first part, we have our case study details. Um, Part of the details here, it says that immediately after you finished the physician's assistant program, you took a job at a free clinic in the heart of the city. You always wanted to help society, especially those in the direst of life circumstances. During your first week, you met Dwight, a 53-year-old overweight white man with several obvious problems. Dwight's feet are cracked and blistered, and he has 3 infected toenails. He tells you he has been homeless for various periods during the last 10 years. There are seeping sores in the folds of his wrists and under his arms. His gums are bleeding. Dwight is here because he has been greatly confused over the past 8 months, and it seems to be getting worse. He has episodes of ranting and raving. He reports feeling crazy and being very scared. His friends brought him to the clinic and are waiting outside. The supervising physician quickly joins you in the examining room. Together, you examine Dwight thoroughly and make a plan for addressing his pressing needs for wound care. The physician starts asking him about his health history. Dwight reveals very little, saying his memory is very bad, but he talks a lot about his past sexual exploits. In our next slide here, we have the list of questions asked from the case study. The first one is, the doctor speaks with you in the hallway. He tells you that mental illness is very common among the homeless population. Dwight needs a thorough psychiatric evaluation. The doctor is fairly sure that some of Dwight's neural symptoms are caused by a sexually transmitted infection. Which one? Caused by which microorganism? And the second question, if the blood test comes back positive, does it mean that Dwight can transmit the disease to others? Explain. Third one here, should Dwight be treated with antibiotics to remedy his neural symptoms? Why or why not? The doctor tells you to expect to see more of these cases in the future, but a coworker who graduated from nursing school 10 years ago tells you that this disease, especially its later forms, is relatively rare and is decreasing in incidence. Who is right? So we're going to observe the first question of the doctor speaks with you in the hallway. And what we found is that based on the information provided in the case study, the neural symptoms in Dwight combined with a suspicion of a sexually transmitted infection, or STI, strongly point to neurosyphilis, a condition caused by the microorganism Treponema pallidum. Treponema pallidum is a gram-negative bacterium and the causative agent of syphilis, which can progress to neurosyphilis if left untreated. And our next question, if the blood test comes back positive, does it mean that Dwight can transmit the disease to others? So if we explain this, we'll see that if Dwight's blood test comes back positive for Treponema pallidum, it does not necessarily mean he could still transmit the disease to others. The ability to transmit syphilis depends on the stage of infection. During the primary and secondary stages, the disease is highly infectious, characterized by sores or chancres and rashes, with the bacteria being easily transmitted through direct contact with the sores or mucosal surfaces. In the latent stage, particularly the early latent phase, there is still some risk of transmission, but as the infection progresses to the late latent stage, the risk diminishes significantly. By the time syphilis reaches the territory stage, or neurosyphilis develops, it is typically no longer contagious through sexual or direct contact. However, even at this stage, the bacteria can still cause significant damage to the nervous system. Our third question, as we observe this, should Dwight be treated with antibiotics to remedy his neural symptoms? Why or why not? And Dwight should be treated with antibiotics to address his neural symptoms caused by neurosyphilis. Treponema pallidum, the bacterium responsible for syphilis, can cause severe neurological complications if left untreated, such as cognitive impairments, vision or hearing loss, and other neurological deficits. While antibiotics, specifically penicillin G, cannot reverse damage already done to the nervous system, they are essential for halting the progression of the infection and preventing further harm. Without treatment, the bacterial infection may continue to cause irreparable damage. Therefore, prompt antibiotic therapy is critical to managing his condition, alleviating active infection and preventing further complications. And our last question here, about the doctor telling you to expect to see more of these cases in the future. And we can see that the doctor is correct. While syphilis, particularly in its later forms like neurosyphilis, was relatively rare and declining in incidence in the past, recent trends indicate a resurgence of syphilis cases. According to public health data, the rates of syphilis infections have been steadily increasing over the past decade, particularly in certain populations such as men who have sex with men, or MSM, and individuals with limited access to health care. Factors contributing to this rise include inadequate screening, lack of awareness, inconsistent use of protection during sexual activity, and a growing prevalence of co-infections like HIV. This resurgence underscores the importance of heightened surveillance, education, and early intervention to prevent severe complications like neurosyphilis. Now here's a few general information about Treponema pallidum, and the scientific name for neurosyphilis is Treponema pallidum. Neurosyphilis is commonly diagnosed in people who are infected with HIV. Treponema pallidum is a form of bacteria. Primary treatment typically includes penicillin G, which is intravenous. And you can see below 3 images here, 2 images where Treponema pallidum is evident in the skin, and in a scientific lab study where we see the bacteria that's prevalent. Within the case study, some of the key words that we noticed were incidence, and incidence refers to the number of new cases of Treponema pallidum infections, or syphilis, occurred within a specific population during a certain time period. The doctor's statement about expecting more cases implies a rising incidence, while the co-worker's claim of decreasing incidence suggests fewer new cases over time. Current data shows that syphilis incidence has been increasing in recent years in many regions, especially due to factors like reduced condom use and limited public health resources. Thus, the doctor is likely correct in this context. And so here we observe some additional characteristics. As a spiral-shaped spirochete, it possesses an extraordinary delicate structure measuring only 0.15 to 0.25 micrometers in diameter and 6 to 15 micrometers in length. Its distinctive spiral form allows for exceptional motility with internal flagella, enabling the bacteria to move with remarkable precision through human tissues. The virulence of this microorganism is particularly noteworthy. It has developed sophisticated mechanisms to evade the human immune system, including the ability to cross critical biological barriers, like the blood-brain barrier and placental barrier, by employing molecular mimicry and producing proteins that interfere with immune recognition. The bacterium can persist in host tissues for extended periods. Transmission occurs primarily through sexual contact, including vaginal, anal, and oral sexual activities. The bacterium can also be transmitted vertically from mother to fetus. It is most contagious during primary and secondary stages, with transmission possible through direct contact with chancre sores. Here's some more additional characteristics where we observe that T. pallidum outer membrane is thin and delicate. It is relatively weak compared to other bacteria. Usually internal flagella or endoflagella have 2 to 3 flagella per cell. They run lengthwise inside the bacteria cell, provide unique rotation, flexing motility, and allow movement through viscous environments. Cellular components include outer surface proteins specialized for immune evasion, limited surface structures within minimal external appendages, and minimal metabolic features that reflects its obligate parasitic nature. And so that's the end of this case study here. Thank you for listening to this case study about Treponema pallidum, otherwise known as neurosyphilis.